I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. We'll try to understand the difference between IVF and ICSI. So these are treatment options that are given to couples that come suffering from infertility. Now, infertility is a condition where you're not able to conceive. If you're under 30 years old, you're not able to conceive after 1 year of unprotected intercourse. And if you're above 36 years, you're not able to conceive after 6 months of unprotected intercourse. So basically these are the definitions for infertility. So and when you have come to us and suppose ovulation induction doesn't work for you, as in if we cannot give you tablets, maybe because your tubes are blocked, or maybe because you have a poor ovarian reserve, maybe because your age is advanced, or maybe because you have hormonal imbalance. All these causes then don't make you eligible for ovulation induction. Suppose you think about IUI, intrauterine insemination. We can't do that as well if your tubes are blocked, if you have low ovarian reserve, if your husband's sperms are compromised. When all these things are looking at us, we cannot advise you to get a IUI done, intrauterine insemination. That's when IVF is advised you. And inside of IVF, once we say IVF, we say let us do an ICSI for you. What is this? What is the confusion about? Well, IVF is in vitro fertilization, and that's how assisted reproductive technologies began. What they did was, in a test tube, eggs were left with sperms, and the sperms fertilized the egg, and therefore the embryo was created. So that was the normal procedure, and it happened in a test tube, glass test tube, in those days 40-45 years ago. Now the name has stuck, in vitro. Vitro is in a glass, so in vitro fertilization. So basically whatever happens in the lab is divided into two kinds, whether it is in vitro fertilization or ICSI, or intracytoplasmic sperm injection as we call it. Let's try to understand the differences and who is it prescribed for. IVF is basically a procedure where the wife's eggs are left with the partner's or husband's sperm, and the sperms do the job on their own. They go towards the egg, fertilize it, and after about 4-5 days, that when we observe in the laboratory, we see that they have become an embryo, and depending on the number, we either transfer a few and freeze a few, or we cancel the embryo transfer, we freeze them all and transfer in another month. So it's all depending on the endometrium, depending on the hormonal values and all. But this is what happens in IVF. Basically, the eggs and sperms are left together. The sperms do the job as it would have been done in a natural course in the fallopian tubes. In ICSI, intracytoplasmic sperm injection, you will understand that each egg is injected with a single sperm. Now this is done manually by a embryologist. The embryologist carefully selects the best sperms out of the sperms that are available from the husband's ejaculate. The sperms are processed, only the good sperms are taken, and one sperm is selected for one egg. And after that, the embryo is cultured for 5 days, and the same procedure goes on. We transfer a few, freeze a few, depending on the number and the quality of the embryos. So what is the difference? In IVF, we have tried to mimic nature. We wanted the sperms to fertilize the egg, and in ICSI, we have tried to select the best sperm and inject it into the egg. So what are the advantages? Well, basically before that, let's see who we prescribe it for. IVF can be done because it's mimicking nature. We believe that the best sperm is selected by the egg, the best sperm enters the egg, so therefore the quality of the embryos will be good. But there is also a small problem here. There could be no fertilization as well. Maybe the sperms are poor quality, that's why the couple is not getting pregnant, and therefore IVF may not work for them. There may be a fertilization failure issue as well. So in such instances, it may not work. If the sperm quality is not good, suppose the morphology is not good, the number is not enough, the motility is not there, we cannot go for IVF. If the number of eggs are very few, then we cannot go for IVF. So those are the issues with IVF, because sometimes there is a fertilization failure and we don't get embryos. With ICSI, we can do it for a large variety of patients. Suppose the count is not there, suppose the motility is not proper, and if the morphology is very poor, all these are factors that can be benefited by performing an ICSI, intracytoplasmic sperm injection. Even if the count is as poor as a few tens or a few hundreds, we can select the sperms and perform intracytoplasmic sperm injection. When the motility is not there also, we can induce motility in such sperms, select the motile ones and inject it into the egg. When the morphology is very poor, the sperms can be magnified almost to around 6,000 times. Sperms can be selected and injected into the egg. So these are advantages of ICSI. Now that the bigger advantage is that the fertilization rate is higher. It's about 80 to 90%. It's a very good fertilization rate, and suppose there are 10 eggs, about 8 to 9 get fertilized with ICSI. That is the advantage, because the more the fertilization, more the embryos, more the selection. Therefore, we can transfer few and freeze few, so that you can have more embryos for subsequent cycles or next child or whatever the options are. So these are the advantages and the differences between IVF and ICSI. If you want to understand more and want to understand what will work best for you, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.